Yeah, elderly, frail patients have the highest risk for infections, no questions, and so we have to be very careful and use the prophylactic measures which are available. So certainly it depends also on the treatment and the phase of treatment the patient is in, because when patients are starting first-line therapy, their risk for infection is much higher than later on. It may increase with the increasing number of prior lines of therapy again. So frail elderly patients should have antibiotic prophylaxis. The question is which one. Levofloxacin has been studied in a large trial, was shown to be effective. Cotrimoxazole may be an option, and several others. And how long? It depends very much. So if the patient is responding well, his risk for infections is going down. If he is not responding, the risk is still high, even after long-standing disease. Depending on the type of treatment, if there is a proteasome inhibitor involved, if there is a CD38 antibody involved, anti-varicella zoster virus prophylaxis is a must, no question. You can then choose from acyclovir to between acyclovir, valacyclovir, famvir. I think there's no big difference in the clinic. And yes, what should be done in addition is, of course, particularly elderly patients should be vaccinated. And there are 4 vaccines which are really a must. Number 1, influenza, no question. Best 2 shots of a highly active vaccine. Then, of course, pneumococci. Again, you start with a conjugated vaccine which protects against certain species. And then you follow this vaccination with a polysaccharide vaccine which has a broader activity against 24 different species. And thirdly, you should vaccinate your patients against, of course, COVID. Every myeloma patient should be vaccinated against COVID. And the question is, what is the right number of doses? And the right number of doses is, of course, 3 doses at baseline. But now you should boost your patients. And according to a recent FDA alert from April 27, you should only use from now on the bivalent vaccines from either Pfizer or Moderna, which protect against Omicron subvariants as well. So all the old vaccines actually are not recommended by the FDA anymore. Also, it may be possible that some of the protein vaccines also protect at Omicron, but that is what has been issued recently. The 4 musts for vaccination are, of course, influenza, pneumococci, herpes, varicella zoster, there's a recombinant vaccine, and of course COVID. And in the future, and this is very good news, the 5th must will be a vaccine, and a respiratory syncytial virus vaccine, which has been approved in the US and will be available by the end of this year. And we know that particularly elderly and particularly frail patients are at high risk for developing RSV infection. So that will be the next must. So there will be 5 musts in the future.